Thank you so much for joining us today for Monkeypox, Know Before You Go. I'm Michelle Meow, and I'll be moderating our conversation today. Thank you to InterPride, the International Lesbian, Gay, Bisexual, Trans, and Intersex Association, the Center for Disease Control and Prevention, and World Health Organization for making today's conversation happen. Let me introduce to you our speakers today. We have Dr. Meg Doherty, who is a coordinator of treatment and care in the Department of HIV/AIDS at the World Health Organization. Dr. Dimitri Vaskalakis, who is the director of Division of HIV Prevention at the Center for Disease Control and Prevention, and Julian Sanjeevan, who's the co-president of InterPride. Welcome, everyone. Thank you so much for joining us for this very important and timely conversation. I think, where we can begin is really, let's understand what monkeypox actually is. So why don't we start with our medical experts. Dr. Doherty, would you like to begin?
Absolutely. And thank you very much for having us. And I just want to say, every time WHO comes onto one of these conversations, it's important to know that there's a whole team behind us helping us get here. And certainly from the HIV department, we've been working with our emergencies department on this outbreak of monkeypox. But many of you are probably reading the literature and are reading what's online, are reading what's in the Twitter sphere. But monkeypox is not a new infection. It's something that we've known about for many, many years. And it's a viral zoonotic disease. What does that mean? It moves from animal to human. And that's where we've seen monkeypox. And it's now endemic, as we call it, that there's been multiple people being infected with monkeypox in 9 African countries. And we've been following this for many, many years. And from time to time, there have been spread of the monkeypox from people coming from parts of Africa to the UK, to the United States. And those have been self-limited, and they're usually associated with having been in the country and or having had contact with the animal host of monkeypox. So the new outbreak that we're talking about right now is really atypical and unusual because this has been now a much larger outbreak than we've ever seen, over 1,000 number of people who've been infected. And in the same period, we're still having about 1,000 or more infections in Africa, in the endemic countries. But this is happening much more rapidly now in the European and other countries around the world. So the spread now is quite different. The virus it's a orthopox virus. It's a virus that's somewhat like smallpox. And I think that's why this is something that has raised the interest of people around the world, because we eradicated smallpox, and that was in 1980. And to see monkeypox now in other parts of the world, it's something that WHO takes seriously, as does CDC and as does all the communities out here. So we have more information, but I could direct you to some of our websites, which could give you more detail about the actual pox virus. Thanks.
Thank you. What is the current status of the situation as we know it right now? Dimitri, would you like to begin with answering that question?
Sure, and I think that Dr. Doherty is going to be able to give a really good view from sort of the international part. But I can say from the CDC, from the national perspective in the U.S., I think we're as of the 7th of June, we had 35 cases, and I think a lot of those cases, though not all, have been in gay, bisexual, and other men who have sex with men, which I think Dr. Doherty can comment more about the international view as well. So I think we really have a virus that can potentially cause disease in anyone that's entered a social network. And I think that I think both of us with our HIV history can tell you that that viruses don't like to stay in social networks. And so I think we're closely monitoring what's happening with the introduction of monkeypox here in the US and the population. And making sure that we're getting the word out to the right population, but also making sure everyone knows that this is a potentially a health threat, regardless of gender identity or sexual orientation. I'll also add that we've had, at least as of now no deaths related to the monkeypox, this monkeypox outbreak internationally. So I'll defer to Dr. Doherty on that for more details, but that is good news. But I think that the goal is for us to really figure out what our harm reduction strategies are, so that people can live their lives, enjoy their pride, et cetera, while also making sure that we really give people the knowledge that they need to prevent transmission of this virus. It tends to transmit by close skin-to-skin contact. So I'll pass it off maybe to Dr. Doherty to see if she has anything to add from the perspective of the international view.
Thank you very much. Perhaps what I do is I show one slide because I think it might be helpful to give you the sense of where actually where the infections have been seen. Are you seeing my slide set here? And I hope, yeah. The one slide on the epidemiologics, excellent. I see it now on the screen. But it gives you a sense that the countries I was speaking about before in sub-Saharan Africa is where it's been endemic and where we've been following this for 40 years or more. But the new cases that we're seeing globally are predominantly in Europe, North America, but certainly there are cases that are now sporadically being reported from around and over as many countries. I think it's now 26 plus countries. And I think that we could expect that's going to grow, and we could expect that the number of cases are going to grow. And exactly as Dr. Dimitri has mentioned, that these right now predominantly have been in men, and predominantly in men who are reporting either gay, bisexual, or having sex with men. And although we're starting to see a few other cases as well in women, and so I think there is this sense that there could be household transmission, contact with other persons, we're starting to see that sort of onward effect of person-to-person transmission, or what we might call community transmission. But it's not like COVID. I think that's the one thing that we really need to emphasize here, is that this is not spreading just because you're in a big room or on a plane. This really requires person-to-person contact, face-to-face contact, skin-to-skin contact. And if you can think about when you were either young or your families had chickenpox, you remember all the kids, would get chickenpox because they would touch and we would share the pox virus that way. So that's the kind of way you should think about monkeypox, is that this is an infection. It's rather subtle pox infection that we're seeing in this social and sexual networks that we're seeing, but it may also just be social and not necessarily only sexual. And that people need to be aware that it could present with small lesions, and be aware that if they had exposure to somebody who's either sick or having some of these symptoms or pox virus, if they're face-to-face, skin-to-skin, close contact, including sexual contact, that they may be also at risk of acquiring the virus. So important to think about that harm reduction, as Dr. Dimitri was saying. And as well as he said, globally, we have not seen any deaths. I think that's incredibly reassuring. Most of the cases have been, what I understand, is subtle. There may be a lot of pain. Some may be serious enough for hospitalization for a period of time, but most cases are not requiring hospitalization and not requiring any treatment, but just supportive care. So I do think that we should expect that this number will grow, but we're in a phase right now where we believe from WHO that this global picture, we need to be able to work with communities, have positive messages, help people to protect themselves and protect others through harm reduction approaches, and see if we can actually stop this from onward transmission to others. So that's where the stage we are now. And I'll take that slide down, but I think this is the kind of slide you can find on the WHO or CDC website regularly, so you can keep up to date with how things are moving forward. Thanks.
Thank you, Dr. Doherty. And you bring up a great point, and it's a great segue for us to discuss the next question, which is, how this is affecting the LGBTQIA+ community, specifically, and not necessarily all medical, but socially. And so this question is open to the entire panel. Dr. Dimitri, would you like to kick us off?
Sure. I feel like the complex answer is that this is not off script for things that our community has dealt with before. And so I feel like it's a sort of moment of great resilience and potentially opportunity, because I think from the perspective of, we're seeing this entering a social network, and it's a social network that I think is connected to, often connected to medical care, often connected to wellness, and also often connected very well to public health, given the history of so many challenges that have happened. So I think that as we are entering Pride season and Pride events, there's so many opportunities for us to give people the necessary knowledge that they need to be able to make educated choices around their own health. And I think one of the things Dr. Doherty said, which I think is so important, is that this can be subtle. And so I think that, our community, when they get the right message, like sort of, if you're sick, stay home, resonates post-COVID. And I think that the idea that now sick may also mean a rash, and that the idea of getting checked out if you have a rash is something that we can create as a rallying sort of point as we enter sort of Pride events. I think that, again, the resilience of the community is great. And there's so many examples. So I think even in the US, one recent one that pops to mind is in a sort of, LGBT resort town in Massachusetts, when we had an outbreak of Delta, literally the community lined up to get tested that we could better understand what the outbreak was about. And it changed what we did in the US. So I think there's so many examples of how when we activate the community, and Pride is so good at doing that, that we actually see really fabulous public health outcomes. So I see it as a really important opportunity. But then I think that from the perspective of health challenge, this is one that we can message. And as Dr. Doherty also said, that we can really give people some harm reduction strategies so they know how to really approach their socializing and their sex lives in a way that allows them to, embrace the joy that's part of being an LGBTQ person, while also having an awareness of what happens if you don't feel well, if you have a rash, or what the different risks may be of different venues that you may attend. And so I just want to plug, we just released at CDC a really great document that is about safer gatherings and safer sex in the setting of monkeypox. It really goes deep into the idea of what harm reduction can look like from the perspective of socializing and sex. So I really encourage you all to take a look at it. And I think you all probably have the link and can share. But again, I see this as more about resilience. And what a great, some people are concerned that this is happening during Pride. I can't imagine a better time to get messages out about something like this. I think we actually have a great opportunity. Thanks.
And we'll talk about some of those harm reduction strategies a little later.
Great.
Julian, what are you hearing, especially, Pride organizers and during a time like this, and maybe offer some things that and how this is affecting the LGBTQIA plus community socially?
Thanks, Michelle. I think just to kind of speak to what Dr. Dimitri mentioned earlier, I think, yes, the community is resilient, but I think the virus is to many people still very new, especially outside within certain regions in Europe and North America, since it's not really endemic to these regions. And I think so there's a lot of uncertainty. There are a lot of questions. People are wondering, how risky is this? And I think my one concern, and a lot of people can speak to this within the community, is the stigma that surrounds this. There's a lot of conversation about this being another gay disease, just like HIV and AIDS, and it's not true. Like Dr. Meg and Dr. Dimitri pointed out, the way this spreads, anyone can be exposed to it. It so happens this is Pride season. There are a lot of community members congregating. They're crowded areas. There are a lot of events. And I think that's also why we're doing this webinar, to actually just get the word out so people are aware that anyone can be infected, whether you're an ally or you're straight or wherever you are. So I think that's a lot of concerns. There are a lot of these concerns out there. So I think getting as much information out there would be helpful. And Pride organizers particularly would be able to do that, whether it's through their social media, doing events, disseminating information leaflets, clubs, saunas. There are a lot of this that will be visited during this time. I think apps. So there are a lot of different ways I think we can find to disseminate information around monkeypox out there.
Perfect. Yes, we will get into how we socialize and how we message. Dr. Begg, anything to add with regards to how this is affecting the LGBTQIA+ community?
Well, I think from our perspective, we have to just really be thankful that this community has come forward, gone to sexual health clinics, that they've been really open about this and I've just seen so many now actually offering their stories and pictures, etc., for the literature and for scientists to better understand what's going on. So I have to say, you know, the community has been incredibly proactive. I think we need to be very happy that we can work collaboratively at WHO. And certainly from my colleague, Andy Seal, who's out there, I mean, our initial conversation was that let's not make this another stigmatizing infection and not a gay disease, and learn what we learned from HIV and not repeat the same mistakes. And I think we're doing a better job of this. And it's times, I think what's good about this and having this conversation right now is where we can start to have really focused messages, and we can start to say, how can groups sort of be empowered and community empowered to take this on and actually help their community to not further spread and to be able to protect themselves. And we've seen this already, that signs are going up, messages are going out, and you know, they're not necessarily waiting for us to give them to them. You know, people are really aware. So we're very thankful for your proactive approaches and that you've invited us to the table here. And so I think, and I just have to say, we give high fives or kudos to the document that Dr. Dimitri just put out, because I think it's really honest. And I think that's where we want to be right now. Very honest and good information out there. Thanks.
Thank you.
One thing, first of all, thanks, Dr. Doherty. We're really, I literally am skipping if I were standing that you were excited about the document. We're really happy. I'm really happy to hear that. But also, I think knowledge is power. And I just want to sort of comment on what Julian said, that all of what we're doing together here is leading with science and making sure that, like, we're telling people what we know at the time that we know, so they can make informed decisions about their health. And I think that that is the way that we can really address and combat stigma, by just really focusing on the science, because stigma distorts science, it distorts knowledge. And so we have to do everything that we can to make it clear that the virus doesn't care if someone is cis or trans, or if they're gay, bisexual. It could potentially affect everyone. And so it's important that as we have a response to a virus, we don't narrow down too fast, because we're going to miss important opportunities to prevent infection. So the science leads and says that the right way to do this is not by creating stigma and discrimination.
Thank you so much, Dr. Dimitri. Julian, back to you, and how we talk about this, how we socialize the messaging without falling trap to fear-based messaging, or adding to the stigma. Could you give us some examples of maybe how we could be messaging among our peers, and especially among our pride organizations?
I think one of the key things that comes to mind is really to focus the narrative that anyone can actually be exposed to the virus. I think starting that language that way, I think would be really helpful. I think, yes, we want to be targeted. We want to talk about the number of cases that are affecting a significant community is important, but I think a targeted way of doing that is helpful. But if we are doing it on a mass platform like social media, emails, I don't think that's going to be the most effective. It's going to be quickly, stigmatizing. I mean, even as we are speaking, I'm seeing some comments that are already quite negative from, folks who are affiliated with a right-wing political sort of stance. So it's interesting to see, and I think that's why we want to be very careful at how we do the messaging and what platform we're selecting to do those messaging. I think yesterday we had an amazing call with a group of folks from WHO on, maybe there could be specific platforms to target gay men or men who have sex with men, and that could be carved in a separate way. And that would obviously look very different from what pride organizers are doing on social media and stuff like that, attaching links to what WHO is providing, what CDC is providing. And again, I'm saying CDC because I'm based here in the United States. I know there are a lot of folks who are tuning in from around the world. Then, the information from both CDC and WHO is not really that far different. So you can definitely share all of that information with and actually encourage this. And please share that not only in your social media, but if you are having concerts, if you are, selling tickets online, you can attach this information virtually as well, so people can actually have that information and read. It's just not on social media. And if you are going to be having closed parties, events, etc., you may be able to find ways to put out posters, or you'll be able to find ways to put out, leaflets or anything like that, anything that would be helpful. We also want to avoid scaring people. That's really not the intention here. It's just how do you protect yourself? Some of the basic things to also keep in mind.
Yeah, and again, we will discuss the harm reduction strategies a little later on and how we get that kind of messaging out. Dr. Meg, Dr. Dimitri, anything to add, how we socialize this without falling trapped to fear-based messaging or inadvertently at times even adding to the stigma itself?
I'll start. And I bet you, just by the fact that we both do HIV work, I bet you Dr. Doherty and I are going to sound very similar on this one, which is that, I think we've learned from many infections, including HIV, that really focusing on the exposure ends up being like the key, and sort of giving people the knowledge of like what the exposure looks like, I think is critical, and then not sort of focusing on an identity. So I think that the sort of that's one of those key, I think, public health strategies that HIV as well as other infections have taught us. And I think to sort of comment on what Julian said, I think that the strategy that WHO and CDC are using are so similar in that we're sort of giving general messaging around this virus that can affect anyone, but also making sure that given the social network where we're seeing this, we're doing another layer of the approach where we're giving like culturally appropriate information that speaks to the population who is currently experiencing disease activity. So I think it's like to focus on the exposures, which anyone can be exposed to monkeypox and could potentially transmit, but then also making sure that the people who are in the network that right now is experiencing increased transmission needs to know like sort of how that fits into their cultural experience and their lives, whether that's in a social encounter or an intimate or a sexual encounter. So I think that's how you sort of toe the line between like the rock and the hard place that we're always in public health and always in HIV, which is how we can inform people without stigmatizing them. And that's what worked in HIV and what works in HIV. So though this is not HIV in any way completely different, I think it's a very similar story about a multi-layered approach that provides information to the general population, but also pushes it through the right networks. And again, what an opportunity we have with Pride, since you all really touch so much of the network that needs to know what's happening.
Dr. Meg, anything to add?
Well, it's hard to beat what Dr. Dimitri just said. I think the other thing that we could add is that we've learned a lot through the COVID process, right? And we learned that to help avoid stigmatizing, its language, its risk communication, it's learning what resonates with communities and ensuring that we're also looking and seeing what's trending on social media. So we have a whole social media team that is looking at what might be false information, disinformation, infodemics. And I think that's important to realize, be a thoughtful reader of social media and ensure that you don't fall trapped to information that's not correct or spreading false information. And as Dimitri just said, we have to keep with the science. We have to have general information and for all populations. So, but also, I think for this case, it's important that we keep it at a level where we're saying this is not COVID. And so we shouldn't be applying all the same things and fear and concerns that we had with COVID, but this is something we're taking seriously. So I would just add that be responsible social media users. And I think if we all do that, that will help reduce stigma hugely. For my part, that's what I see happening in many ways. It's happening in this this sphere of the internet. And it's really a shame that we can't go, that's all we listen to these days. It's a great way to get communication out. It's a great way to connect, but it's a really terrible way to spread rumors that are not based in fact or science. Thanks.
Thank you so much for that reminder. And thanks for all of you who are submitting your questions. We are getting them. We're going to open up Q&A in just about 10, 15 minutes here. So keep them coming and we'll try to get to as many of them as possible. So let's talk about, reducing our risk, especially before you head out there to a Pride celebration or any party or, all that stuff that's coming up. Who would like to start and kick us off? What steps can individuals take to prevent monkeypox or reduce their risk?
I can start, unless Dr. Doherty, I'll start. I think we're doing a good WHO CDC together, so I'll start, and then you can add more. So I think that the first message, though this is certainly not COVID, is if you don't feel well, and not feeling well includes a rash, seek medical care. And it's probably not the time to go into a social environment or a sexual environment. So it's like self-awareness. And I think that it's something that is so important. And one of the reasons I think that, that as Dr. Doherty said, like we're seeing so many people streaming into STD and sexual health clinics to be evaluated and really identifying cases, which is so important. So I think that's like the first part. And the second is just understand like how monkeypox transmits. So I think it's close physical contact, often skin to skin, sometimes through fabric or objects that may touch the monkeypox lesions, and then potentially also from the respiratory perspective, but likely primarily through very close physical face-to-face contact. And so know that that is sort of the way that monkeypox transmits. So the harm reduction perspective is if that's a part of what you do, like, which is again, like what some folks may have as part of their plans, like just have that self-awareness. And if you have a rash or you don't feel well after you go to events, go get checked out and start to list the people that you may have had contact with, if you remember or know them, even if it means going through apps and seeing folks that you may have like interacted that you met on a virtual space, because very often public health folks will actually be working with you to identify if you have contacts so that we can offer them strategies to prevent transmission of monkeypox like vaccine, et cetera. So I think that those are really good strategies. And also think about, people may not change the number of sex partners that they have or what intimate encounters that they have, but potentially thinking about the venues. So, given like what we know, like you may want to think about, is the sauna the right place to be? Is the bathhouse the right place for me to be? If it is the place that you go, awareness about what happens if you start to feel sick or have a rash is critical. So I think that that's really the advice. I feel like we should have, wonderful prides and enjoy each other and celebrate what being LGBTQIA plus means, but then also have an awareness that there's something out there that we just need to have like some self-awareness and know that if we do have something going on, important to seek care and to think about potentially holding back on some of the other socializing. Dr.
Meg, anything to add? Go ahead.
Yeah, no, I think that was really excellent advice. I really can't add, but the one other thing we could start to practice as well is sometimes what we do when it's, having those difficult conversations like we had around COVID, even though we know this is not COVID, but if you're in contact with somebody or you're socializing and you don't feel well, have those conversations about, be honest and open about, do you have lesions? Are you feeling unwell? I like this idea of being able to understand, because when we're thinking about trying to reduce the spread, the onward spread to other contacts, it is important to know who you've been with, if you can, to the extent possible, and if you can't, to try to limit that, especially around these events, knowing that there is monkeypox out there. What we're doing around the public health approach right now is really good old epidemiology. We should be able to know contact trace, be able to say who you've been with, who could have been exposed, much as we did with COVID, where you could say, oh, somebody in my office, we feel really open about sharing if somebody had it, so maybe I should get tested if I don't feel so well, and be thoughtful and respectful with people about what is happening and not blaming, not shaming, but it's also taking responsibility for your own health to know that you could share also if you have symptoms with any of your partners or household contacts. I think the other harm reduction are some of those other simple things that if you are found to have monkeypox, you have symptoms, you go to a healthcare provider, you're diagnosed, isolate and if you can refrain from some of those social activities. And if you have a household and people who are living with you, if you have lesions in your mouth, you could wear masks in the house. We've given that recommendation. Clean your bedding, clean what we call fomites, which are, it's always a strange term, but it's things that where viruses can stay and where you'd want to clean your bedding or clean sheets or clean clothing. And that way nobody else would have contact. Because what we said, and Dimitri said, is face-to-face contact, skin-to-skin contact, and lesion-to-lesion contact. And when the lesions are still open, that's when the virus can spread from person to person. And so not until the lesions are fully crusted over and is when we say, okay, it's safe now to have those big hugs and then have all of those social interactions that Dimitri is speaking about so well. So the harm reduction too in the big events, I think we feel like the parades are open air. These should be safe, but it's when there may be more private events where we really want to be able to ensure that those messages are out there. And certainly for the work that we've done in HIV, hepatitis, STIs, the communities are the best messengers. Public health doctors may not be the right people at this time, and it's really good to have those messengers out there who can bring the information directly to those who really need it. So thanks.
Great point. So I think that's a great segue to you, Julian. Maybe some thoughts around how we also collaboratively work together, especially Pride organizers, in helping to reduce our risk or getting the information out.
Thanks, Michelle. I thought it was really interesting about what Dr. Mack said, using the community to get the word out. And I think that's great, but I think sometimes right now, especially when there's a lot of uncertainty, it's a lot of fear mongering that's also going on. And I do want to caution people who, if you think that's making you a little concerned, refer to WHO and CDC websites. That's always going to be the best resources, at least for now. And obviously this is developing. There's a lot of new information coming out. So keep that in mind as well. I think what folks can do, at InterPride, we're providing a lot of information that we're going to be made available on our website and our social medias. We're encouraging folks to use that as much as you can to disseminate. A couple of things that we would encourage as well for Pride organizers, like Dr. Mack pointed out, if it's an outdoor event, it's it's less risky. But I think our concerns are more those that are going to be indoors, that's going to be in closed environments. If Pride organizers can collect information as people are going to be registering in, to just kind of let them know this would be a way to, to kind of get the word out to folks. If it's like contact tracing, right? If they're going to be someone who kind of finds out later they have monkeypox or something, the organizers can then try and get the word out to others who've participated to maybe get tested or whatever that they can do to take care of themselves. Please also encourage your attendees to not come to specific events if they're not feeling well. That's going to be very, very important. Please get that word out. I think that's going to be important. If you can provide condoms, hand sanitizers during these events, this will also be really, really helpful. I think in many countries, a lot of this are made available for free in large amounts. I think that can really, really help. And I think these are simple things that we can do. Additionally, something I mentioned earlier, if we want to be able to put together information leaflets that can be disseminated ahead of time to attendees, that would be really, really helpful. So these are some things that can be done. And I think if we work together and maybe share resources among Pride organizers, that will definitely make this a lot easier. And InterPride is here to help.
Thank you so much, Julian. All great points. We're going to open up for Q&A very soon here, but I want to give Dr. Dimitri an opportunity as he has prepared some final comments or statements, remarks for all of us to listen to and remember. Dr. Dimitri.
Great, thank you. And so much of what I'm about to say we've already said, but I think it's just good to say out loud that, this is really an important time for people to be informed about what people can do to protect themselves and therefore protect their community. And I feel like, especially the LGBTQ community, we are such a community that really works together. And so our individual health is our community's health. So though the risk is theoretically low, the message is, like I said before, the same for everyone. And I think that Julian and Dr. Doherty have said it, I think. So I'm going to just say it again, that we should advise people to see their healthcare provider if they don't feel well. And that also includes a new, even subtle, unexplained rash. So this isn't the time to hold back. If you see something, it's important to do something. If you don't have a provider, I think so many public health clinics, STD clinics, sexual health clinics around the world, including the US, are available to you. And we have very much clued them into this. So there's an awareness in that space specifically. And also, and I know this isn't new to people who are in the LGBTQ community, is we are our best advocates. So when you see a healthcare provider, it's okay to say, hey, just so you know, there's monkeypox circulating around in the community, and I'm a little worried about this rash. So though we shouldn't have to teach providers, and we're working really hard to make sure that they know, it's okay to advocate for yourself to move in that direction. And then also, just like Dr. Doherty said, this is like the time where when you don't feel well or you have a rash, just take one moment, take a pause from some of the social activities and sex until you know what's going on, because then you can go right back into sort of what your plans were, or potentially change your plans to avoid transmission. And I think ultimately, the other really important message, and I think we've all said it, is that we have to approach this, especially as the LGBTQ community and leaders, in a way that we are avoiding stigma and really avoiding discrimination. So it really is exactly what we're doing now, which is a partnership between healthcare providers, public health officials, affected people, and others to make sure that people know what they need to protect themselves and their loved ones. And by loved ones, I mean our big chosen family as well. So our utmost priority, and I think it's when I say the R, I think I'm including Dr. Doherty here, is to help everyone make informed decisions so that we can protect their health and also, again, the health of the community. So again, the bottom line is we're going to keep updating what we advise people as we know more about the science, but what we always have to consistently go to our home base of not actually having stigma propagating any of the message. So it's really about the science leading and us just making sure that we're telling people who need to know all that they need to know, while making sure everyone else is aware of this virus circulating. So I know we said that a lot sort of in other ways during this, but I think it's worth saying again that that's really the strategy, and it's this teamwork like the one that we're having here with folks who are organizing prides that I think will really get us to a place to better control this outbreak.
Absolutely. And we'll get back to everyone and your final thoughts a little later. But let's get some questions in from the audience. We have one here for Dr. Dimitri. To what extent is protection against this iteration of monkeypox conferred to individuals who were initially inoculated against smallpox? In the context of PrEP and the explosion of barebacking, how do you successfully convince a population tired from both COVID and AIDS to return to safer sex practices?
So I'll start, and I bet Dr. Doherty also has some ideas on this one as well. So I'll start by saying, so is there a way to see the question again? It disappeared. So so there was a lot of parts to that. So I'll start with protection based on prior vaccination with smallpox vaccine. So a lot of those vaccinations happened many decades ago. So most people are not actually vaccinated against smallpox anymore. So I would say that though there is protection that is confirmed, it's not reliable. So I think it's really important to sort of realize that those folks who got vaccinated 40 plus years ago, it's not enough to hang your hat on that to say that that's good enough. The second question about PrEP, and I'm going to also add U equals U, so undetectable is equal to untransmittable, that has led to folks having more condomless sex, I think really brings a really important conversation around in terms of monkeypox, which is that though this is a sexually associated disease, we don't really know if condoms really confer a significant amount of protection against monkeypox, since it's that skin-on-skin contact. So I think about monkeypox in some ways similar to advice that we give around herpes and advice that we give. And if you remember community-acquired MRSA when it was in the gay bisexual community, where it's like a sort of sexually associated infection, but probably not one that transmits and that could potentially lead that can be protected by condom use. So though I think condoms are a fabulous way to prevent pregnancy in populations who can become pregnant, and also to prevent some STIs, I don't think they have like a huge role in monkeypox. And I think it's a little bit of a false sense of security, thinking that condom sex will protect from monkeypox. With that said, U equals U and PrEP works, so we can prevent HIV with or without condoms, but definitely the condom has a role in other things. Not sure if it has a great role in monkeypox.
Dr. Meg, anything to add?
Well, I think Dr. Dimitri, as usual, has got it all right. But I would add that we know that the smallpox vaccines, about 85% protective against monkeypox. But certainly we don't know if those people who are in their 40s and 50s and 60s who've had that vaccine, if any of their immunity has waned. So I agree that it's not a guarantee. There are other vaccines that are being developed, but not widely available at this point for monkeypox. So also relying on the thinking that there's going to be a new vaccine coming down the pike for this right away for all people is probably not the best way of thinking about how we're going to handle this current outbreak. Although it's pushing a lot of new science and a lot of development of new vaccines. And there may be a role in for those who are incredibly at higher risk or as PEP, these vaccines, but they're not at your community store or your community setting right now. Secondly, about the immunity, I think this is a huge area of investigation that needs to happen. You know, if somebody has a monkeypox infection, is that going to protect them again if they are exposed again? And that we don't know. And there's just very little data and studies around this. And just, I think it's important to think that even if you've had it or you think you've had it, doesn't mean that's going to protect you from getting it again should you be exposed again to this virus. We hope there'll be some level of immunity, but that has to be studied for sure. And so those kinds of research and development are getting underway right now, and WHO held a big meeting around what are the most important research questions that need to be done quickly, like we did with COVID, so there can be pooling of information, et cetera, so the answers come quickly. I think the other question around, you know, people are tired of COVID, not wanting to go back to all the challenges people had before we had good antiretrovirals and before we had good PrEP. It's really understandable, and it's really, you know, so what we do know, and I think that's good to continue, those people who are using PrEP regularly, those people who are taking their antiretrovirals and are virally suppressed, who may not be using condoms during sexual activities, they're actually going in and having regular STI checks. And so those regular STI checks are really important. So keep those up, because in many of the cases right now, that's what I was saying, subtle, there can be it can be like herpes, like syphilis. It could come together with both of those infections. So I think it's really important to have that high suspicion for any kind of subtle lesions that are happening, and use your healthcare providers and your sexual health providers liberally during this time. And I think the question about condoms and is this a sexually transmitted infection, I think we just need to have more time, more data, more information to know where we're going to go. And just as Dr. Dimitri said, the science is evolving, and our job is to make sure that as it evolves, that we give you new messages. And it's normal that those messages may change with time as more science becomes available. Certainly there may be, we know that this is sexually, you know, it is happening during transmission can happen during sexual activity, but whether or not condoms are protective, we know that that's probably not going to be fully protected at all. But I think condoms are actually fairly good if people use them for other STIs as well. So, but we know that those messages are difficult to handle when we've been all under so many precautions for so long that it's hard to keep up these public health measures. So do what's best for yourself, think about your own risk, and protect your loved ones. Thanks.
Ooh, can I add something? Just because I love being on with Dr. Doherty. This is a lot of fun, actually. But I just want to say that this is the time when you use your sexual health, all the infrastructure that's sort of designed to get people what they need for sexual health really liberally. So don't hold back. This is like, given that there's things going on, like this is the time to say, I want to get that extra check. I want to go to the clinic. I want to see my doctor. And like, we go see physicians and other medical providers if we have a little scratchy throat. So if you have a rash, go see the doctor. So I just want to sort of echo what Dr. Doherty said, that this is not the time to hold back. If you're concerned, you're right. You're doing the right thing by getting checked out.
Thank you so much, both of you. Julian, something to add?
Yeah, no, I was just curious because I know there's a lot of conversation around the vaccinations earlier. And also I'm just curious because, we're talking to an international audience here. I just don't want people to feel that, that the likelihood of vaccination available in certain parts of the world is guaranteed immediately. If that is something that's going to happen, because we've seen with COVID the inequities around the distribution of vaccinations. So I just don't know if Dr. Meg or Dr. Dimitri might be able to talk to that a little bit more, because I just don't want people to take that sort of information away.
Yeah, I think this is a really important point, and it's something that we talk about a lot at WHO, because certainly we've lived through 2 years of COVID. We've lived through the fact that vaccines for COVID really haven't reached low and middle income countries to the extent possible, or in as fast as we had hoped. And so in many ways, we're also saying here, there's been 40 years of monkeypox in Africa, and now we're waking up. And in Europe and the United States, and we're activating the R&D machinery. So it does feel that we should then use this as an opportunity to ensure we do it well this time. That if there are new vaccines that come out, or production of new vaccine, that there's a sense of that the vaccines go to where they're needed. This is not going to be mass vaccination. Our vaccination guidance will be coming out towards the end of the week or so. But the one thing we can say is we don't see that there's going to be a need to vaccinate everyone. So whether you're high risk in the United States, in the UK, in Congo DRC, in Nigeria, wherever it may be, we'd like to be able to see those people at greatest risk having access and equal access and equitable access to vaccinations. We may not be able to get there that quickly, so we don't want to overpromise, but I do think what we want to say is the goal here is to identify people who are going to benefit the most from vaccination. Those might be people who are case contacts of contacts, healthcare workers, and certainly we want to see that is equitably shared. But certainly not everybody is going to need a vaccine for monkeypox at this point in time. Thanks.
Thank you so much. Great points. We do have a question here, and it goes back to what Dr. Meg, you were saying, that the information is evolving. We're still trying to find out more information. The data changes. There's a question here that says, how long should organizations keep the information? Or maybe it's more of, how often should we be checking back for the resources that we've shared here through the chat box? Any recommendations?
From WHO, the information we put up, we are changing probably weekly, where you can get a really good sense of what's new. And for WHO too as well, every week, every Wednesday, we have a press briefing where our Director General, Dr. Chedros, speaks about all the big issues that are happening. It usually covers COVID, it covers monkeypox, it covers the other outbreaks that are happening around the world and the challenges we're having around the world with health. So I would say every week. And if you're more interested, follow WHO, and anything important on Twitter will come out. And I know WHO also has a Facebook account, LinkedIn, as well as probably all the things I don't use, like Instagram, etc. So if you're really social media savvy, you can get daily updates from WHO, and that would be important because that's where the information comes out regularly.
Dr. Dimitri, anything to add from the United States perspective, the CDC, how often it updates its information?
No, so I think on our situation update that's available online, we update it daily, but I think that a weekly check for resources is probably wise. We also do frequent press briefings as well, and so the other piece I really encourage folks to do is to also keep tuned to your local health authority. So though I think the WHO and CDC are fabulous resources, also knowing what's happening on the ground based on what's in your own jurisdiction or area is really important. Realizing that there may be some variability in terms of what access looks like, and definitely the CDC and WHO are great resources for information, but like also keep an ear to the ground in terms of what's happening. I think a lot of local jurisdictions are sort of clued into the fact that this is Pride Month and it's going to be really busy, and so I think it's just good to sort of touch base, even to potentially, I mean, they're actively reaching out to you, I hope, but I think it's also fair to reach out to them if you have any questions about more local issues.
Yeah, maybe I add something to that too. And we've seen it in Europe and in the UK as well, that there was initial concern that the sexual health clinics were going to be overwhelmed. And so in some ways, calling ahead, getting an appointment, those kinds of things, talking with the provider on the phone and letting them know what you're coming in for would be recommended, so that they can actually say, come in now or wait 2 days or so. Yeah.
Got a couple more questions before we leave a moment for all three of you to give your final thoughts. This question is for everyone on the panel. Recalling the hells to which the right wing exposed us during the AIDS epidemic that equated LGBTQ sex to immorality, and in the context of the misinformation that circulates so glibly on social media, how do we prepare our community currently from the indubitable assaults on us ontologically that are sure to come in the wake of monkeypox? James, what a wonderful question. Thank you so much for that. Who would like to kick us off with that question?
Oh, I'll take it. Let's see. So that's a really great question. And I think that there's so many important things that you brought up. His name was James, that, I think that the key is that, we toe the line every day from the perspective of infectious diseases that may potentially impact the LGBTQIA community, to make sure that folks are aware of how they can protect themselves while not creating stigma or over stigma or like pointing toward a population. I think that our job, especially from within the LGBTQIA community, is to make it clear that that this is an infection that heeds no social borders. And so that our job is really the trusted messenger. And so I think that that's like where I think we get our power, which is that rather than sort of falling into the disinformation that this is somehow a infection that's tied to an identity, just always go back to the home base, which is that this virus can affect anyone. And that it's about the exposure and it's knowledge of like how you can get exposed to the virus and what to do if you have symptoms, rather than sort of allowing any sort of over identification of this virus with any community. So, I think we've learned the lessons from HIV. And we've learned the lessons from other infections. And I think that, the community, I think, is geared in a way to be able to be resilient and also to defend itself from any sort of folks that say that this is a infection that only infects gay and bisexual men. It's not true. And you have the power of the WHO and the CDC behind you as like the trusted scientific voices to empower that conversation. And remember, June isn't just for Pride events. Lots of festivals happen, lots of other things happen. So it's really our duty to make sure that if we're doing good public health, that we're not just focusing on Pride events. So we're so happy. I'm so happy to be here. I'm sure Dr. Doherty is too. But like, we're having the same conversations in other spaces, regardless of whether they focus on LGBTQ people or not. So that I think is the way that we can address your very important observations. And though it's hard to change the past, we sure can change the future.
I do want to say that was a really great question. I think one of the things that I'm observing, during the era when we were just discovering HIV and AIDS, social media was not, there was no social media the way it is now. And I think social media takes that hate and that kind of conversation to a whole different level. And I think one thing that we will probably see most of that on social media anyway. And I would really encourage our community to start reporting a lot of those kind of hate talks, just report inaccurate information. And I think the more that we do that, I think we will be holding a lot of the social media companies or responsible to flag information, just like the way they started doing with COVID. And I think the more that we do this collectively as a community, I think that will really encourage that kind of change as well that we'll be able to see.
Great points. Anything else, Dr. Meg?
No, I think it was said well. I think, our messages are always there. It's never okay to stigmatize anybody. And this, as we said, anyone can get monkeypox. And we know it because around the world, we've seen it in adults, women, men, children. So I think we just remind people that stigmatizing is never okay.
Absolutely. One last question from our audience here, and that is a question about how long organizations should keep attendance information in order to track potential contacts.
I think this is attendance information for those attending the events, for example, so they want to know how long they should maintain this.
I think this is a very interesting idea because I do think that it's in, having the ability to contact is an important, and if there are venues that they do take attendance and they can take attendance, one could think about maybe the time from the event. It's usually the incubation period or the period that people can transmit until, where they acquire an infection until when it shows up is anywhere between 6 and 13 days. I mean, if this is all personal information, you don't want to hold on to it for a long time. But I think if you wait 3 to 4 weeks after the event, but I don't take that as a God gospel because we haven't really created a guidance around how long to keep that information. But I would say from date of people who may have been exposed during that event, should show symptoms or signs if they got infected of at least 3 weeks. And then afterwards, they probably will not be showing signs or symptoms. I think also maybe take a cue from some of the work that was done locally for COVID. But certainly, I think this idea of having sign-ins to restaurants and other things like that is going to be very difficult. And we're not expecting any kind of recommendations around that at all. It may just be around these private events or pride events where one can have a list. I don't know if the CDC has come up with some guidance around this because certainly we can share our best practices to make sure that we're doing it in a way that's helpful and not harmful. Thanks.
So I don't really have any sort of specific comment beyond that. So I think that definitely there are strategies that can be used, make sense, but then also really focusing on ways that minimize stigma and also burden is really important.
Yeah.
Thank you so much. All right, we have a couple minutes left here, and I would love for all three of you to leave us with your final thoughts, especially focused on monkeypox and pride and what to know before you go. Julian?
I just want to just remind what we've all talked about, the stigma around this, just being very conscious, very careful of how we're communicating. I think it's going to be important. InterPride is here to help and support. We'll be having a lot more of this kind of sessions. We'll be working very closely with both WHO and CDC to figure out ways to disseminate more information. We're putting together information sort of one-pagers, links. We'll be sharing all of that. So please do look out for that. Hopefully that'll be useful. And you can help disseminate this to other prides that you're working with, that you know of, that might need support. Again, we're here to help in any way we can. And that's the key. And we're collaborating very closely with science-based organizations. So, that's the way to go.
Dr. Dimitri.
So I'm going to leave us, I think, from my perspective, with the easy statement: knowledge is power. And sort of like, I think we're all in agreement that sort of going back to the science and avoiding the stigma is the way that we're going to navigate this, and frankly, how good public health happens. So I think that having self-awareness, knowing about monkeypox being out there, having a very low threshold to seek medical service, and then also being a messenger. So I think that, Pride is such a great way to get so many messages out. We've been using it for decades to get messages out about HIV and STIs. So with this new challenge, it is just such an opportunity for us to empower people with the knowledge they need to make informed decisions about their health. So I thank you all in advance and really encourage you to tune in to CDC and WHO as we learn more and our messaging evolves, so we can give you the tools that you need. Thanks.
And Dr. Meg.
Well, I just want to say exactly what Dr. Dimitri and Julian said, but I guess I can end with saying, we'd like to come in a week or two, or maybe in a month. We'd love to come back and hear what were your experiences, what worked, what didn't work. So having those conversations are really important, and I know that WHO is really going to, as the CDC, have multiple opportunities to reach out and to have these conversations. And I think is protect yourself, protect your loved ones, protect public health. Try not to spread if you know you have symptoms. And I think it's really about personal and also public health responsibilities. So thank you.
Michelle,
Thank you. Go
just
ahead,
wanted
Julian.
to welcome. Dr. Mac, we're always here, so we will take you up on your invitation. But I do want to just end with one sentence. This is not a gay disease, folks. This is not. Want to reiterate that this is not an LGBTQ disease. This is not a gay disease. Just keep that in mind. It can affect anyone.
Absolutely. Well, thank you to all of our speakers here today. Thank you so much for taking the time to educate and inform our community. Julian, Dr. Dimitri, Dr. Meg, thank you to all of you who joined us for this special webinar. More to come. Thank you to ILGA. Thank you to CDC, WHO, and InterPride. If you'd like more information, you can head to interpride.org. I'm sure all there will provide the links and the information that we talked about today. So thank you all. We'll see you next time.